Now it's going live. Now we're live. I am super excited on this Sunday morning to be going live with Dr. Roseann. It's her Saturday afternoon, so we're super grateful to have her. And every time I have to introduce her, I'm like, what is the long list of things that we can talk about in terms of your professional title? But you are a pediatric mental health expert, am I correct?
Yep, an integrated pediatric mental health expert.
And a total media genius because you've just been on Fox this morning. So we're totally running with this because I'm like, hot off the press, we've got to get Dr. Roseann into our lives right now. Because I just posted on Instagram saying I interviewed you at the beginning of us going into lockdown when we were first talking about because America was ahead, and you gave us some amazing tips in terms of children being at home, now homeschooling. And I'm sure most of my audience at that point thought, hey, but we're not even doing this yet. Hot off the press, we're a few weeks ahead, thanks to you. And now you're already taking the media by storm, talking about what we're seeing and what I'm speculating is going to happen in New Zealand and Australia as well, re-entry panic syndrome. It's a real thing. So Dr. Roseann, tell us a little bit about what you're seeing and what that is.
Yeah, so, I coined the term reentry panic syndrome because in my own world of not just my patients, but even some of my friends and employees were really more nervous and anxious to re-enter the world, Shelley. They were pretty much highly stressed and essentially some people freaking out. And this is a really valid issue. People have a right to be anxious. They have a right to feel the way that they feel. Nobody should ever tell anybody that the way they feel is wrong, whether they're, ready to jump into the world or stay inside. Everybody in this range of emotions and all these waves of emotion, more than range, is valid. And so, what I was seeing is some people are so afraid to come back into the world. And you don't have to have had a history of anxiety or
Yes.
mental health issues. This can be a new feeling for you, but you feel panicked, you feel unable to re-enter the world, and you are not ready to come out of quarantine. And there's some valid parts to it, Shelley, in that, we just don't know enough about the virus, what's going to happen. And so that feeds the worry because there is some validity to the worry. It's just, at least where we are, Shelley, the America and other parts of the world are starting to reopen, right? You're in pretty heavy quarantine still.
Starting to reopen here as well, and we know that it will start to reopen domestically. So that's why I was like, there's going to be a lot of fear because how do you go from being told that it's unsafe, that your environment's unsafe? And I've even watched it on a small example with my dog, where she's had 9 weeks of nobody touching her, nobody, like people crossing the street, people not wanting to go near her. And now what's going to happen when people want to touch her again? She's getting anxiety about it because now people are coming closer to her. And she's like, what is going on? And so I'm watching it with a dog, and I can only imagine how scary it can be for small humans and adults too. Like, it's a very real thing. So how do we go from the world is scary and in that fear response to now overnight, in some cases, the world is safe?
No, absolutely. And, where I am, we are doing a step approach to reopening in the state of Connecticut, which is a good thing because I think we need rules and regulations in place. So how do you go from that? So, we trademarked a protocol called the REPS protocol, REPS, and it has to do, it's an acronym for respirate, envision, positivity, and stress management. And this is applicable, Shelley, to all ages, children and adults. And adults in general, I think, feel the anxiety more. Kids are more adaptable to change. And guess what? Kids want to get out. And if they're
Yeah.
calm and looking forward to going out, they're going to go with the flow. They look to us in our level of stress and anxiety. So the first thing people need need to do is respirate. And that's a fancy word for breathe. And
That is a fancy word for breathe.
fits really nicely in the R. So,
I do like it.
so, breathing, we have the ability, no matter how stressed we are, we have an ability in that moment to control that moment, and we can control what we are thinking, right? And so when we intentfully practice breath work, we are able to calm our nervous system down. And my favorite breath is either a 4-7-8 or a 5-7-8. The end breath, the 8 has to be the exhalation, has to be the longest. And it does a few things. So the breath itself, when you're doing a belly breath, is going to bring air and obviously oxygen to the brain and body. Just that alone is going to calm you down. But the rhythmic breathing is going to get your nervous system out of this hyper state and walk it down. And when you train in this rhythmic breathing, and you do it from training, meaning you practice a few times a day, your nervous system is more likely to get into its own healthy rhythm. So breathing is easy, it's quick, it's something you can do anywhere. You even do it when you're sleeping, but not intentionally. And so it's a great tool. And then I like when people in all areas, but in stressful areas in particular, to visualize a positive, visualize an outcome that you want to see, and start thinking about how you're going to move from being quarantined to the first outing you're going to have. So just like your dog, you're not going to take him to the dog park or out to a major area with 100 things. You're going to take them, to the next door neighbors,
Totally.
comfort, start visualizing where that first successful outing is going to occur. So when you're anxious, we go to the negative. And so the next step is positivity. We want to really think in the positive. So when fear comes in, which is normal and natural, we want to shift to a positive thought. And really, if you can, you're home quarantined, you're going to vocalize out loud a positive statement. So,
So, yeah, give us an example. So, if we're thinking like we're really scared, so if this has become a real anxious thing, we weren't an anxious person in the past, so this is all new experiences, things going through our bodies that we've never experienced before. What is a good starting step? Like, what would be a safe thing? And then how do we visualize it?
so each person knows where they're most comfortable in terms of where they actually see themselves going. So I'm going to the park. Like I think most people who are anxious about getting ill after the quarantine, they're probably most feeling comfortable with the thought of being in an outside area, right? And there's a lot of safety protections in place. So visualize yourself there, see yourself what you're doing, and say out loud to yourself, because your subconscious is going to hear this. And guess what? Your subconscious is running the show. We always think our conscious brain is running the show. It's not. It's not. Only 5 to 0.05% of the time your conscious brain is in charge. So when you say out loud, I'm going to the park, I'm going to stay there for 10 minutes. It's going to be positive. I'm going to remain healthy. I am going to walk around the track one time. Whatever it is you're going to do, say it out loud. Say that positive statement out loud. And it's really, really powerful how this can help you. If you say, oh my gosh, I'm going to go to the park, I'm going to freak out, you're going to go to the park and freak out. And I always use the analogy with positive statements that, what do elite athletes do? They don't go, I'm going to suck at hitting the ball. They're like, I'm going to the park. And guess what happens? Positive outcomes happen. And the same can be applied to stress. And the last step is just stress management. So whether you're doing breath work or yoga or EFT tapping, whatever strategy you have chosen or multiple ones, you need to practice it, and you need to practice it every day, at least 3 times a day for 5 to 10 minutes, so that you can start getting your nervous system to calm down. Because if your nervous system isn't calm, you can't think rational thoughts. And then,
100%. And
right,
Roseann, is there a reason you picked 3 times a day?
I think of things in threes. You could do it 10 times a day if you want, but 3 is okay. I'm going to do it in the morning, I'm going to do it in the middle of the day, and I'm going to do it in the evening. It seems manageable. So, even if you use an app for meditation, Insight Timer, Calm, Headspace, or biofeedback device, Heart Math, you're going to, for 5 or 10 minutes. This is as long as it takes. It's not that hard. You just have to act do it, right, Shelly? I mean, you and I do these things all the time.
Totally. But key word here, Dr. Roseann, is the acting. If we want to get fit, we have to do exercise. If we want strong muscles, we go to the gym, and we seem to be able to do that. But a lot of people forget with their brains that that's also a muscle that we have to work. And we're working at whether we like it or not. Like you've touched on that point where you're either rehearsing going to the park and it being absolutely awful and having a horrible time, which is what our brain predominantly wants to do unless we rein it in and work the muscle. So we either just let it wander off and do whatever and then live out that experience, or in safe ways that feel safe for us, because that's what I'm hearing you say, we can rehearse, okay, we're going to go to the park. I'm going to spend 5 minutes there. And what you've also given us is tools in our toolbox. If we get stressed there, the first thing we can do is listen into our breath.
Right. Absolutely. And, you can, that's what I love about breath work, that everybody can do it of any age. I started teaching my kids when they were 2 on how to do this. Kids love these kind of things. And it is very, very effective. I mean, you don't have to go beyond that unless, people have natural levels of anxiety about re-entering the world. There's no doubt about it. There's hardly anybody that has zero anxiety. Some people might say yes, but that's okay. Maybe less than 5% of people have zero. So there's a continuum of this normal anxiety. But when this is really preventing it, I know multiple people that gave up their job because they could not go back. And they were not even in a high contact job where you have to physically touch people. So, that is a problem for most people. And in these cases, for people where it wasn't like they were independently wealthy, their families needed to do this. So it's interfering with their livelihood and their ability to be in their old life. I mean, in that case, when you've tried things on your own for a short amount of time, you really should reach out to a counselor or licensed therapist virtually, and they can help you get through this. And, like we said, Shelly, some people may have never experienced this kind of anxiety before. Other people did have conditions or had an anxious predisposition or OCD, and it's way worse. Hopefully they're in contact with their therapists. But, this is a strange time, Shelly. Like every time I think, oh, we know this, there's another tangle. And I just wanted to validate what I was hearing. And that's what this reentry panic syndrome was about, is that this is a very valid and real condition that is, I think, going to cripple a lot of people. They're going to feel stuck. And I wanted to give them the tools in a really simple way, a 4-step way that they could do.
100%, Dr. Roseann, and that's what I'm so grateful for, is you've given language and terms to what people are actually experiencing and letting us know that it's okay wherever we are on the spectrum of re-entry panic syndrome. If it's down here or if it's up here, that is so okay. And we're navigating something new that we haven't experienced as a society, as a global world before. So thank you so much, Roseann, for your time, for just acknowledging that it is something that's really real that you're seeing, and just allowing us to be gentle and kind to ourselves as we go through this process, and knowing that we have tools, we have people like you that we can reach out to, or local people in our areas that are there to support us, and it is okay to ask for help.
It is really okay to ask for help. A lot of things have come out of this pandemic, and two good things are that people are really understanding that they need to take care of their physical health and mental health. And
100%.
end of story. There's other things that are important, but those really are the most important things. And I love to see the shift that there are people who are really like, hey, I kept getting allergies and now I'm going to Shelly, or I always had anxiety and now I'm going to Dr. Rowe. So I think it's important that people in time that they're connected with themselves. And you're right, be gentle and kind to yourself. But if you're feeling so panicked, please reach out for help because there is help.
100%. So thank you so much, Dr. Rowe. Go and take off your fox makeup and enjoy the afternoon with your family.
Nighttime now, Shelly. I've been up since 4 a.m.